Hello everyone, my name is Horbachevskyi and I'm from Global Medical Foundation, Delhi. Right now I'm in the campus of Ternopil National Medical University, and with me is the Vice Dean of the International Students of Ternopil National Medical University. Sir, thank you so much for your time. I'd like to start by asking our dear sir to introduce himself and talk something about Ternopil National Medical University.
Thank you for coming here. Hello everyone, my name is Mr. Furdela. Mikhailo Furdela. I'm Vice Dean of the International Student Faculty. I'm responsible for medical student which study general medicine, but for senior student, 4th, 5th and 6th year. And also I'm the teacher of the pathology department. I teach pathology on 3rd year for student which study general medicine in our university. I will tell you some information about our university. First of all, the Ternopil, now we are National Medical University. We have a very long history of the education for international students. The first student will come in our university more than 20 years ago. So from that time, more than 5,000 students graduate our university, different specialty of course, and a lot of them work like a doctor in different countries. Few words about our specialty and the resources of the university. First of all, the main amount of the foreign student we have in the general medicine. A little bit foreign international student we have on the dentistry faculty and also pharmacy faculty. We have also nursing faculty or nursing institution, just bachelor program and the master program for nurses. So the duration of study for the general medicine program, it's a 6 year. The first 3 years it's like the pre-clinical training, and the next 3 years it's a clinical training. We have special faculty of the international student because in our university now more than 2,000 international students, but now we have the bigger society. It's Indian citizen, more than 500, I think, more than 500 people from India. We have the student from another country, from Europe, such as Poland, Germany, from Africa, of course. We have Ghanaian citizen, we have Nigerian citizen. So actually, this is the bigger society, international society in our university. About the education, I told that 3 year pre-clinical. Next 3 years it's a clinical training. After the 3rd year, each student have a special Ukrainian license exam. It's a step 1, and from previous year our Ministry of Public Health introduced new exam. It's an IFOM exam, International Foundation of Medicine exam. That exam maybe similar like the USMLE exam, United States Medical License exam, because the question is so similar. And according to that result from previous year, our Ternopil National University have a first position in the Ukraine for the IFOM exam. And also we have, I don't remember exactly, maybe 3rd or 4th position for the step 1 exam. After the 6th year, the student will have also Ukrainian exam. It's a step 2, but if the new student which take the IFOM exam will have the IFOM exam clinical subject, or clinical exam after the 6th year, to the 6th course. This is the general information about medicine, about the medical specialty. Very interesting system of the examination in our university, because each exam the mark for each exam we calculate from 3 parts. The first part is average. During the whole year, the student attend each classes, and in each class the student will have their mark.
Right.
So we will calculate average. After that, after the end of the practical classes, the student will have MCQ test, and also will have a mark. And if it's main subject, like a basic subject, such as anatomy, histology, physiology, biochemistry, pathology, pharmacology, on that department, student will have also oral conversation with the professors, and together we'll have 3 marks from average from each class, MCQ test, and the oral conversation. We will calculate together. So, and I think so no mistake for the calculation or for the analysis of the knowledges of the student.
Right.
This is about the system of the examination. If you want, you can ask me.
Yes, I have one question, particularly about IFOM. So IFOM is a new examination. A lot of parents and students are worried that might be an extra burden. But from what we know, Ternopil National Medical University had the best result. What would be the reason, or what preparation did the university provided to the students, that the Indian students plus the Ukrainian students, or I can say international and Ukrainian students, got the best result?
Yes, so we know about this, and the 1 year before that exam we start very good preparation. Our department organized the special additional classes for Ukrainian and foreign students for the preparation of the IFOM exam. One position. Second position, we adapted our educational program in each department, pathology also, of course, pharmacology, anatomy, histology, biochemistry, physiology, for the the Western system of the medical education. What I mean? I mean that system of medical education in the USA, in the Great Britain, in the another industrial country.
Right.
And we adapted we changed some material and adapted according. For me, it's we use now we teach our students according to the Robin's book, 10 edition. It's so modern edition, the last actually edition of the pathology book. And we adapted our educational program for according to that book and according to the system of the medical education in Western industrial country. This is the 2 methods, and we stimulate actually our student, and they inform that it's serious, it's for you, and we motivate the student for improve the knowledge for that good result.
Yes, and as far as we know, and the reputation that this university has, is this one of the strictest universities, and any student who's coming here, he or she has to study.
Yeah, yes. Everyone. So when we have the first meeting with our new student, we inform our student that medicine it's very hard, and the study in medical university it's very hard. It depends. It will be the Chinese university, Ukrainian, Russian, United States, Germany, or another country. The medical education it's so difficult education.
Exactly.
And one more thing, if that student motivated, if the student wants to be the doctor, to become a doctor, so if the student ready to spend a lot of time to the library, to the department, to our clinical hospital, so that student will have a good result, and it will open the whole door in the life.
Yes. So I would like to thank you again for spending so much time and talking about the university. And in the end, I'll just like to conclude by saying that if you want to study and your main focus is to become a doctor and you are devoted towards your cause, so definitely you should come to Ternopil National Medical University.
Welcome to Ternopil National Medical University. Thank you.
Thank you.